Hi, my name is Jillian Lever.
And my name is Hunter Ackerley. We're the co-founders of CCAP Across the Map.
A CCAP Across the Map, the acronym CCAP, standing for Cervical Cancer Awareness and Prevention, is a nonprofit corporation that addresses the cervical cancer epidemic by providing cervical health education and increasing access to HPV vaccines and diagnostic screening measures to under-resourced areas around the world.
We recently made a trip to central Mexico.
So while we were there, we actually provided educational seminars about HPV vaccination for cervical cancer prevention and then the VIA diagnostic method to the community healthcare workers in the Jalisco area. Additionally, later in the week, we also provided the skills labs so that they could actually practice in a hands-on environment the VIA method that we taught them.
We had the opportunity to reach out to an amazing organization called the TIA Foundation that does rural healthcare work down in Mexico all the time. They were a great support system and mentor for us when we were in Mexico doing our first field project for cervical health.
From the meetings that we had with the Director of Health and the President of Mascota, we actually have 3 ongoing projects that we're going to be doing in the greater Jalisco area. Now, the first project is providing these HPV vaccines to girls ages 9 to 12 who live in orphanages. And now, the reason that we're targeting this specific age group is because the vaccine is actually free for these girls, but a lot of them actually aren't getting the vaccine due to educational barriers. Now, the second project that we're going to be starting is actually an HPV campaign for boys. Now, normally the HPV vaccine is affiliated with cervical cancer prevention, which is correct, but there are actually other types of cancers that HPV can cause, including head and throat cancer, so it's very important that every single person get vaccinated against HPV. And then our third and final project is actually accumulating a psychological resource reserve for patients and for people who know patients that are dealing with cervical cancer.
In Mexico, we trained community health workers on a very useful way to diagnose cervical cancer that's way more affordable than the traditional Pap smear. It's called visual inspection using acetic acid. And this is very important because it's an accessible way for community members to use a simple ingredient, household vinegar, with a speculum and a cotton applicator, and of course sterile conditions, to test for cervical cancer in a way that has really never been more accessible. So it's really important for these people to get screened in general. It's important for their cervical health, for their health in general, and to maintain that health in the long run. So by providing this affordable opportunity for them to get screened for cervical cancer, we were really impactful in the way that we shaped their future cervical health.
The people of Mexico were so incredibly accepting for our project. We of course love doing the work that we do and are very passionate about cervical health. But a really great part of CCAP Across the Map is actually getting to foster these communal relations in areas all around the world. Now, we worked with several people while we were down in Mexico, including volunteers for the medical brigade, of course our TIA Foundation partner, and then also doctors who work in that local area. And so having these people was invaluable to the success of the project. And then of course our project was very well received by the community members themselves.
While we were in Mexico, we had the opportunity to have 2 amazing interviews with professionals in the region. The first interview we had was with the Director of Health for the entire area of Jalisco. And in that meeting, we learned about the need that the community has in that area of Mexico for HPV vaccines, Pap smears, and the lack of accessibility that people generally face in the region. Our second meeting was with the President of Mascota. In that meeting, we learned about the opportunities where we can start to begin to educate the community more about HPV, the importance of the vaccine, and also how to maintain health in terms of cervical health.
So for the educational seminars and trainings that we did, just speaking a little bit logistically, we actually had a PowerPoint presentation for the HPV and VIA educational seminars that we delivered to the community healthcare workers. We were able to work with 2 doctors who work in that local area and to use this PowerPoint presentation to convey all of the general material. And now before we administered these educational seminars, we actually gave each and every single one of the community health workers a pre-survey just to evaluate their knowledge and where they were prior to when we came in. We then administered this exact same survey after our educational seminars so we could do a little bit of impact analysis just to determine our impact and make sure we were actually helping them in the way that we intend to.
2 of our amazing partners were very generous and donated speculums and other materials for cervical health screening when we went to Mexico. The 2 organizations were Project CURE and the Mayo Clinic. These donations were immensely helpful to our mission and we were able to give these materials to the healthcare workers in the region so they could continue to do the healthcare work that we taught them about this time on this trip.
One of the really amazing things about cervical cancer prevention is that there's a vaccine known as the HPV vaccine that is known to prevent around 95% of cases. And that's why it's of the utmost importance that every single person get this vaccine, since cervical cancer is entirely preventable.
We stayed at a beautiful outdoor hotel in Mascota in Mexico. And honestly, it was a great experience. We were close to all of our teammates, all the people from the TIA Foundation, and it was really beautiful there, even though we really couldn't figure out how to lock the door on the first night.
We had an amazing time and found great success working with the TIA Foundation in Mexico that we're actually now able to expand into Africa in January of 2021. And now while we're there, we're going to be working with an organization known as the Pauline Foundation, and we're going to be doing pretty similar work to what we did with Mexico. Of course, there will be alterations made as the Uganda community needs are surely going to differ from the Mexico community needs. Specifically, we're actually going to be expanding into more women's health platforms and making a CCAP across the map training manual for these communities in Uganda.
In order to complete our next mission in Uganda, we need to raise $10,000 in order to be able to afford the travel, the supplies, and the accommodations, as well as translations and transportation in the region. Anything you can do to help support the mission to save the cervix is greatly appreciated.
Thank you so much for your ongoing support. We started doing our work domestically in the United States, where CCAP across the map is actually headquartered, and then now we've luckily expanded to Mexico and are working on getting into Uganda. Now Mexico and Uganda, those are only the beginning, and so we sincerely thank you for your ongoing support.